Requires states to conduct eligibility redeterminations every 6 months. All right. I think now I'm not at the Medicare age. Well, I didn't realize that so many young adults was on Medicare. Let me say that, because it said 19 to 64. In my mind, I'm thinking Medicare is more for the seniors or people who have, health issues and things like that. So that was something new to me when I read that Medicare is actually for people 19 to 64. So requires the state to conduct eligibility redeterminations every 6 months. Now, I don't know how often you all have to do redetermination now. It's probably less than a year, probably maybe annually. But now you have to do it every 6 months. Oh, it says that, which the expansion population, which was previously a maximum of 12 months. That's what I just said. Most redeterminations are annually. Now they are requiring you to do redeterminations every 6 months. So that's something that you all should be aware of. This vastly increases the administrative burden on states and beneficiaries, raising the risk of people losing coverage due to paperwork errors or missed deadlines. So again, if you are used to redeterminating your Medicare annually, you now need to know that it's every 6 months. And they just said that if you're not paying attention and you miss your notice, because they may or may not send out a notice depending on what state you in. Every state is not well with how they handle their taxpayers, right? And so that's why I said this is going to really show on a state level how you all's elected officials are handling business for you and speaking on your behalf, if they're doing right by you, all right? Because everything is not on the federal level. And this is what you all have to understand. A lot of stuff and money gets passed on the state level. What's going on, Tyrone? The other thing that I wanted to break down with the Medicare is, because this is something that I think a lot of people are not aware of. And your current president is always on the news talking about this. And I think a lot of people don't know this. There are a lot of foreigners, immigrants, legal and illegal, that are on government assistance. That's a fact. A lot of people want to get on this internet and lie, and that is a lie. That is a fact that they are on Section 8, Link, Medicare, Social Security. Okay? So what this new bill, what the big beautiful bill new requirement is for immigrant eligibility, restricts Medicaid eligibility for several lawfully present immigrant categories, including refugees and those granted asylum. Chicago has spent billions of dollars here for asylum seekers. Okay? They have received more money than any community, okay, of taxpaying citizens, okay? But they have been telling you in the city of Chicago at City Hall that they have to study your reparations. But they definitely gave a nice amount of reparations to people who are not citizens, okay? So this bill, it requires that. They are restricting certain immigrants to have Medicaid benefits. So at this point, it says it further limits access to government subsidized health care for these populations. And if you're understanding and following why your government is shut down right now, this is the whole thing that they keep talking about, is that it's shut down because of health care. It's shut down because they're not agreeing to this health care. Well, word on the street is the Democratic Party wants to continue to give more money and health care to these immigrants, legal and non-legal. All right. Mostly the argument is for illegals. No one is arguing about legal immigrants, right? We have 180,000 legal immigrants in the city of Chicago that have been living here 20, 30 years legally, productive members of society. We're talking about these new ones that came over, that did not go through the full immigration process. And that's where we get illegal and legal, right? Immigration is a process, you all. It's certain things that people have to go through in order to come in to our country, across the borders, go through health checkup and things like that. That was not done these last 4 years with your precious Biden and Kamala in office. All right. And let's be clear. I am an independent. I'm not Republican. I'm not Democrat anymore. I used to be. I'm no longer a Democrat. Ben got off that blue slave trade mindset. When you become independent and you can see things clearly, especially when you're an entrepreneur, we see things clearly. We can see things on both sides, right?